Everyone's cracked their knuckles before, but have you ever wondered what the sound you're hearing actually is? Today I'm going to go through what happens to your body when you get a chiropractic adjustment. I'm Dr. Jen from SNU, your fitness and therapy experts. First, I'll go through what an adjustment actually is. We call it spinal manipulative therapy, or SMT. It's actually a high velocity, low amplitude thrust that is applied to a joint. Basically, what that means is that it's a quick but not forceful thrust applied to the joint. This is why someone my size is able to adjust someone much larger, because it's all about the quickness of the adjustment and not about the force that you're providing. Next, I'm going to talk about what a joint is. A joint is two bones coming together. Usually it's surrounded by a capsule, and in that capsule there's fluid which allows the joints to glide smoothly past each other. Every joint within our body is designed to move in a certain range of motion. Our elbow moves differently than, for example, our neck, our mid-back, and our low back. We call this our active range of motion, and this is a range of motion that we ourselves are able to move. So for example, twisting side to side, we are able to get through the active range of motion. We also have a passive range of motion that we ourselves are not able to engage. That's why we need therapists or chiropractors to help us attain that range of motion as well. An adjustment aims to restore proper movement and range of motion in a joint that is restricted or not moving properly. In most cases during an adjustment, an audible pop or the cracking sound is heard. When a joint is adjusted or moved quickly, an air bubble may be released from the fluid inside the capsule. That causes the audible popping or cracking sound. In most cases, the sound is audible and loud, but it's not associated with pain at all. Most adjustments are pain-free. Chiropractic adjustments are not only beneficial when you're experiencing pain or you have severe symptoms, they're also great for maintenance and prevention. I'm Dr. Jen from SNU, and remember, you're only one strategy away from crushing your fitness goals.